Welcome to Nexus Medical Media. In this video, we are going to talk about another fat-soluble vitamin called vitamin D. Right, so vitamin D is actually a steroid hormone, right? It's in calciferol class. The active form of vitamin D is 1,25 dihydroxyvitamin D, also known as calcitriol. Sources: where do you find the vitamin D? Right, the first one is calciferol. That's vitamin D2. You find this in mushrooms, fortified foods, for example, milk, breakfasts, cereals, formula milk, yeast. Right, so yeast is like from ergosterol. Next one is cholecalciferol. That's vitamin D3. Right, so this one is actually synthesized in skin, in the stratum basale, when the skin is exposed to UV light. And you can get it again from fortified foods like milk, breakfast cereals, formula, fat fish, from liver, egg yolks, and plants. Right, don't worry about these big terms, cholecalciferol. We are going to dive deep and you understand what all this is. Right, so that's biosynthesis of vitamin D. Right, so you have two sources, as I said. You have like mainly from the skin, synthesis from the skin, and from the diet. Right, so upon exposure to UV light, there is a 7-dihydrocholesterol in your skin is converted into pre-vitamin D3, right? And this vitamin D3, you can get it from these foods, right? So it will go to the liver and it will be acted upon by the enzyme 25-hydroxylase. So it's converted into a 25-hydroxyvitamin D. This will go to the kidneys and will be acted upon by 1-alpha-hydroxylase. It's 1-alpha-hydroxylase, and it will be converted to 1,25-dihydroxyvitamin D. This is calcitriol, right? So, okay, let me remind you that vitamin D is the only vitamin that the human body can produce entirely on its own. Remember, on vitamin K, we said it's not our body actually producing it. It's bacterial. It's like intestinal flora and in very small amounts. Right. Okay, what are the functions of vitamin D? Vitamin D is mainly for calcium and phosphate metabolism. It increases the absorption of calcium and phosphate in the intestine. It increases reabsorption of calcium in the kidneys and is also important for stimulation of bone mineralization and remodeling. That's at lower vitamin D levels, right? It does this indirectly through the maintenance of serum calcium and phosphate levels, and directly through activation of osteoblast and promotion of osteoclast differentiation. And the next function is bone resorption at high levels, right? So remodeling, mineralization and remodeling at low levels, and bone resorption at high levels. And here again, you can take another look on how it does the remodeling part. Right, so this is a diagram showing this metabolism and control of calcitriol, right? That's vitamin D, right? So let's just start from calcitonin, right? These are the main hormones, right? So we already talked about calcitriol, that's vitamin D, and this is parathyroid hormone produced from the parathyroid gland. You find this in within the capsule of the thyroid gland, right? That's where you find these four. And then calcitonin you find is produced by the C cells of the thyroid gland. A thyroid gland, you remember, is it usually it produces T3 and T4, right? But the C cells, this one produce calcitonin, right? So what is the function of calcitonin in bones? It reduces bone resorption, thus reducing calcium and phosphate release. In the intestines, it reduces calcium absorption, and in the kidneys, it reduces calcium reabsorption and reduces phosphate reabsorption. In the blood vessels, it reduces calcium, and most importantly, it reduces serum phosphates, right? So you can see that calcitonin is produced when the concentration of calcium is very high, right? You want to reduce it. That's why we produce calcitonin. Parathyroid hormone, right? So parathyroid hormone, in this case, you want to increase calcium. You want to increase calcium. So in bones, it increases bone resorption, thus increasing calcium and phosphate release. In the intestine, nothing to mention. And in the kidney, it increases calcium reabsorption and decreases phosphate reabsorption. In the serum or in the blood, right, it increases calcium serum and decreases serum phosphates. Calcitriol, it enhances bone mineralization in the intestine, increasing reabsorption of calcium and phosphates. In the kidneys, increases reabsorption of calcium and phosphates, and also in the serum, in the blood, it increases serum calcium and phosphates, right? So I want you to note that there is an enzyme called 1-alpha hydroxylase. If you remember it, it converts 25 hydroxyvitamin D into 1.25 hydroxyvitamin D, that's calcitriol, right? So this parathyroid hormone, it activates, it has a stimulatory effect on this enzyme, right? So that's why you see that the goal of calcitriol and PTH, all in all, is increasing serum calcium. If you look at calcium, right? Okay. Vitamin D deficiency, right? So what causes vitamin D deficiency? Number one is lack of exposure to sunlight. This is particularly higher risk of deficiency in heavily pigmented skins and use of sunscreen due to inhibition of vitamin D synthesis. Next is malnutrition, and this is common in chronic alcoholics. Malabsorption disorders, for example, fat malabsorption and chronic gastrointestinal diseases. Chronic kidney diseases or advanced liver diseases, this is due to impaired hydroxylation of active vitamin D precursors. Breastfeeding without supplementation of vitamin D in infants less than 1 year of age. Preterm infants have an increased risk of vitamin D deficiency, and last but not least, drug interaction, right? So you see that cytochrome P450 inducers like anticonvulsants will increase metabolism of vitamin D, therefore decreasing its concentration. Clinical features of vitamin D deficiency. So in adults, there will be osteomalacia, right? In osteomalacia, you find features like bone pain and tenderness, pathologic fractures, waddling gait and difficult in walking, myopathy. You see muscle weakness, spasms, and cramps, right? So basically what you will see here are the features of hypocalcemia. In children, it's mainly rickets, right? So this is an X-ray of a child with rickets, right? So these are some of the features, right? So you can see the etiology of rickets, the actual cause is vitamin D deficiency. You can see the pathophysiology, disorder in mineralization of osteoid and growth plates. And for diagnosis of rickets, you will see that there will be low levels of vitamin D, low levels of calcium, and increased levels of parathyroid hormone, decreased phosphates, and increase in alkaline phosphatase. Right, for treatment is definitely supplementation of vitamin D and calcium, and you treat the underlying disease, what's causing this deficiency, right? So you can actually look at these causes like malabsorption and address them, right? So these are some of the pathognomonic signs for rickets. Next is vitamin D toxicity. What causes toxicity? Number one is obviously oversupplementation. It can also occur because of granulomatous disorders like in sarcoidosis, right? So this is due to increased 1-alpha hydroxylase activation in epithelioid macrophages, which increases 1,25-dihydroxyvitamin D synthesis, right? So this will leads to high levels of calcitriol. That's the active form of vitamin D. That's toxicity. The clinical features will be hypercalcemia, hypercalciuria, loss of appetite, and stupor. Therapeutic uses of vitamin D. Vitamin D is used in osteoporosis for prevention and treatment. Also used in Paget's disease, and also in a prenatal supplementation of vegetarian mothers. So in this case, you'll give 400 international units per day of vitamin D. Thank you so much. If you like this video, please make sure you give it a thumbs up, leave a comment in the comment section, and subscribe. And after this, that's a guarantee that you're going to win.